Hola, DNA. Before we jump into today's episode, I wanted to encourage you to subscribe and rate All Access DNA on your favorite podcast player. This helps people like you find the show. On this episode, we talked to Priscila Delgado Hodges, she, her, Ella, about Parkinson's disease and her work in this area as a research genetic counselor. Her primary role is supporting the Parkinson's Foundation's PD Generation Study, which provides free genetic testing and counseling for 7 key PD-related genes to individuals diagnosed with Parkinson's. We discuss the genetics of Parkinson's disease, and we talk about how important it is to have community connection in research and the impact of language-inclusive care. Let's get started. Well, welcome, Priscila, and thank you so much for being on the show today.
Thank you for having me.
First, I wanted to ask, what is Parkinson's disease? I feel like a lot of people have maybe heard of it, but may not know exactly what it encompasses.
Yeah, so Parkinson's disease is a neurodegenerative disorder that affects actually movement. So it happens when certain nerve cells in the brain actually stop working the right way. They don't produce enough dopamine, which we know is a neurotransmitter. Think of it like a little chemical messenger that transmits signals between nerve cells in the brain. And so that's basically in a nutshell, what Parkinson's disease is. And it actually is the second most common movement disorder, and it occurs from data about in 1 to 3% of the population.
And that's most likely why people have heard about it, because it is one of the more common movement disorders. Do we know at this point what causes Parkinson's disease, or what do scientists think causes Parkinson's disease?
Yeah, so believe it or not, that is like the most frequently asked question from people that I speak with. It really is a very complex disorder. It is believed to be multifactorial in most families, and multifactorial, which is the fancy genetics term that we use that means like many different factors really. And so we know genetics can contribute as well as environmental factors, and we know that there are things like exposures to different chemicals or pesticides that can increase the risk for Parkinson's, as well as head trauma or well water drinking and even aging. So those are some of the things that we know contribute to increasing that risk. But there are probably other things that we just don't know. So at least when I am talking with participants and we cover like that specific question, I like to equate it to like a little puzzle. And so you have all these different puzzle pieces coming together and interacting with one another, kind of just to show you the complexity and how many different things come together.
And it's not just one thing. So I think that's something that people think a lot about with just conditions in general, that maybe there's just one cause and we can figure out what that cause is, but it's much more complicated than that.
Yeah, absolutely. It is many different things, and people usually, like when we go through that list, they kind of have like their own mental checklist and may say, I was exposed to, pesticides when I was a child and I worked in a farm for, 3 summers. Is this my reason for Parkinson's? And it's kind of like you're putting puzzle pieces in, but at the very end, you don't have the full picture. There are many other things that could have contributed as well. And so it's really hard to answer that specific question for a lot of people unless, there's like a clearly very specific, cases where there is a genetic component that has a pretty big significant role playing that specific case for that individual.
Can you tell us more about what role genetics play in the development of Parkinson's disease?
Yeah, so there have been some studies that have identified certain what we call pathogenic variants in Parkinson's disease, and this has been seen in about 5 to 10% of cases for individuals. But there's actually a recent paper that came out in the Brain Journal last year, and it's the report on the genetic data from the PD generation study, the kind of halfway point. So we have data from about 8,300 people. And it has been shown that individuals, at least 13% of individuals that did the testing had a genetic variant. So there are cases of Parkinson's disease where we can detect a genetic variance. There are certain genes that have been really vetted that we know play a role in Parkinson's disease and fall under that kind of like monogenic Parkinson's disease.
Then that means there are multiple genes that play a role. So it's not just one. And it doesn't necessarily mean that somebody will get Parkinson's if they find one of these like genetic changes or mutations. It means there's an increased chance of getting Parkinson's.
It depends. So there are certain genes that would pretty much explain an individual's Parkinson's disease. So, for example, that would be the case of Parkin gene. For example, if we're thinking about GBA1, that would be something that would increase the risk for Parkinson's. And depending on what variant it is, the chances for the disease to be expressed is variable. It could be 10 to 30% depending on the gene. So the penetrance is variable. So it would be what we call reduced penetrance. So the data from what we know is, at least within the study, it covers 7 different genes, but an individual may have Parkinson's disease, like in the case of Parkin, because they have 2 variants, one in each copy of the gene, and that explains their Parkinson's disease. In some other cases, the individual may just have one variant in GBA, and they happen to have other things that happen in their life that may eventually, or that they eventually develop Parkinson's disease and had that what we call predisposition, like how I explained it for some people.
Mm-hmm.
So it just really depends for what we see.
Mm-hmm. So if someone in my family had Parkinson's disease, it would depend on if they have that genetic component and which of those genetic components it is to determine if I'm at risk or what my risk is to get Parkinson's disease.
Yeah, so I think something that I always like to keep in mind is that we all have a background risk for Parkinson's. So we all really have a risk to develop Parkinson's disease. It's about 3% up to age 80. So we all have that risk. But then if there is for example, individual, first degree relative that has Parkinson's disease, and there's no one else, then in that case, we would say to that individual that their risk would double. But another example could be someone has a variant in, let's say, LRRK2, then the chances for that individual to develop Parkinson's disease is not going to be 6%, it's going to be different. The gene is going to be something to keep in mind, and what variant in the gene, and how many variants, because if we're talking about, again, Parkin, it is what we call recessive kind of presentation that we see. So the individual needs to have 2 variants, one in each copy of the gene, in order for the person to develop Parkinson's. But if the person only has one, then that's a different story. So there are many different things to keep in mind when we're thinking about risks. And so that's why it's always important to have that opportunity to talk to a genetic counselor if someone is concerned about Parkinson's disease, because maybe they have a very strong family history. Mm-hmm. Then having that conversation would be really helpful, because they would be able to look at the family as a whole and take into account genetic testing and see, and kind of go from there in order to be able to provide the best kind of tailored risk assessment for that individual.
And we'll include a link to the find a genetic counselor feature, because I know some people have looked at when they've had questions after listening. When you talk about the genetic testing, you mentioned genetic testing. Since there's several genes involved, there's also a lot of environmental factors. Like you said, it's one of the more common movement disorders. It doesn't sound like everybody with Parkinson's disease undergoes genetic testing. So how do you know, I guess, what are the things to look for to say, oh, I'm somebody that should potentially have genetic testing, or I should talk to a genetic counselor about testing?
Yeah, so keeping in mind that I am a research genetic counselor, I think the way that I think about this is, if someone has a very strong family history of Parkinson's disease, that would be a good idea to go and try to find a genetic counselor that specializes in neurology that may be able to provide them more information about that and kind of assess. Also, for example, if someone is diagnosed with Parkinson's disease and maybe it's really early onset and they want to learn more, that would be a kind of another instance where an individual can go. Those are just just two examples, but I think right now the way that genetic testing is evolving, more and more individuals are able to get genetic testing for Parkinson's disease in the case of having a personal diagnosis. Even now, for example, with the PD generation study, it actually offers genetic testing free of charge for individuals with Parkinson's disease. And so they can actually get the testing and also get the wonderful bonus, which is having a session with a genetic counselor to be able to discuss what those results mean and kind of tailor that for their families. If someone has questions, wants to learn more, and they have concerns, I think it's always nice to be able to reach out to a genetic counselor that works in clinic and that may be able to guide them and help navigate that.
And that was actually my next question, was if somebody wanted to learn more or had concerns about their family history, what would be the next step? And it sounds like it's trying to find a neurological genetic counselor.
Yeah, I think a genetic counselor that specializes in neurology would be kind of the best next step, because they may be able to kind of take the whole information and kind of make an assessment from that. I know that, sometimes people want to learn more. There are people that really love all the information that is out there, and may not even have a family history of Parkinson's disease, but they just want to know all they can. So I think that's where the guidance and kind of having that conversation with the genetic counselor would be helpful, just so they can kind of figure out and understand the risk, benefits, and limitations of testing.
That makes sense. And it's so fascinating to me because I came up through training when there was no neurology genetic counseling, or it was not even something that we studied or were exposed to. So it's amazing to me when I find out more about this area in genetic counseling. And you mentioned that you're doing research. So you're purely a research genetic counselor. So that means that you don't see people clinically. So if somebody wanted to see somebody for counseling, it would be somebody practicing clinically and not based in research like yourself.
Yeah. So the only instance where someone may be able to speak with me would be because they actually participated in the PD generation study, and then they happen to be assigned to me to review the results. So that would be a specific instance, but unfortunately, if someone just connects me and is like, "Hey, can I have genetic counseling?" That's not my role. I would basically direct them to find a genetic counselor, and that way they can actually speak with someone in clinic who may be able to help them.
Right.
But I will, unfortunately.
Right. Well, tell us more about your work. So I understand it's through the Parkinson's Foundation, and it's called the PD Generation Study. And we'll put it in the show notes too, so people can find it. But can you tell us a little bit more about what you do there and what the study is about?
Yeah, so I am actually I work with Indiana University, so they are my main employer. But Indiana University actually collaborates with the Parkinson's Foundation, who is the sponsor of the PD Generation Study. And so our role within Indiana is we are the genetic counseling core for the study. So we really advise in everything genetic counseling and genetics related for the study. And so my specific role is a little bit different in comparison to my wonderful colleagues, just because I do a lot of outreach to the Hispanic community. When I started back in May 2020, there was a lot of interest into trying to get the Hispanic community involved.
Mm-hmm.
And it's really important to be able to have someone that looks like you to kind of explain a study, just because you're able to make that connection, at least within the Hispanic community, that's really important. And so my role was to be able to figure out what are some of the needs within the Hispanic community. And, during the pandemic, we actually did a lot of virtual events
Mm-hmm.
where we had some educational sessions in Spanish about Parkinson's disease. We covered different symptoms that people had questions about, and we had, little times where we would have like a break and maybe do some exercise, like virtual exercise for Parkinson's disease. So I that's kind of what I did at the beginning, and it has evolved with time, just because the study itself has evolved. So now the study has expanded with the support of the Global Parkinson's Genetics Program, or what we call GP2. So the study has expanded into Latin America. And so now some of the things that I do revolve around training providers in Latin America. So we're actually building capacity to be able to have providers that participate or are involved in the study and offer the study in their countries to return those results to participants. And all that kind of expansion into Latin America has been made possible because of a pretty amazing collaboration with Large PD. So Large PD, it's the acronym, but it's a mouthful. The real name is the Latin American Research Consortium on the Genetics of Parkinson's Disease. So this consortium is amazing, and it's led by Dr. Ignacio Mata from Cleveland Clinic. And they have a network of many different providers in many countries in Latin America. And through that collaboration, the study is now offered in those countries. And now I'm involved in the training of some of those providers. And so actually, we just recently started our second wave of training providers. And so we go through every single step of the genetic counseling session. Actually, they get to send a video of themselves doing a disclosure. We kind of provide materials that have been really vetted by the Forbidden Diana. We provide them all the up-to-date information for Parkinson's disease genetics. And so it is a really wonderful initiative with some very key people that has made this possible. And so that's kind of how my role has changed. So there's still a lot of involvement with the Hispanic community. And now the outreach has shifted a little bit. So now we have the opportunity to do actually outreach events in different countries in Latin America. So last year I went to Cali, Colombia. And this year we have some plans to do some other outreach events to tell people about the study, to tell people about Parkinson's, just because the community, the Hispanic community, really wants to learn more and understand. And so these are great opportunities to learn about Parkinson's, learn about the disease, learn about research, and have the opportunity to participate. And kind of like full circle, because they will get the test and they will also get to hear about what the results mean. That's kind of what my role is and what I do now.
That's amazing. So I've worked in cancer genetics, and there were times where we worked on different ways trying to do some outreach in other countries, but it's always kind of fragmented and it was hard. So I appreciate that there's the larger consortium, but like you said, it sounds like it's a few key individuals who really were able to get this much more widespread in multiple countries.
Yeah, I think so. The Large PD consortium is something that already has a long history in Latin America. And so it's because of that history and trust that the providers have with Dr. Mata and everybody from the Cleveland Clinic that trust has been able to be kind of like connected with the Parkinson's Foundation. And their studies. So it's that what kind of has helped, just because they already have the Latin American Consortium has their own study. They have the large PD study. So what they did is basically like connected both and offered now people the possibility to receive the results, because large PD, the study within itself, they were not able to return results to participants. And so here comes PD generation, and now people can actually get the results back. And so it really is a perfect like relationship that exists between both, because there is just the end product is just helping the community overall to understand about the specifics within each country, because every country has their own little extra surveys and things that they do to learn more.
Mm-hmm.
But then also people get the opportunity to get the results back and actually receive something, because before they didn't get that opportunity, but now they do. So it's really great, and it's wonderful to be able to work with so many amazing people in Latin America, and of course Dr. Bata and people at the Parkinson's Foundation. Everybody is very invested and really involved, and want to really give back to the community. And having that possibility to have genetic counseling is just amazing.
Mm-hmm, mm-hmm. And like you said, that there can be limitations and access challenges in genetic counseling. So it sounds one of the ways that this study and these groups are working is to have you train the providers, right? So it's then empowering and enabling other folks to go out and be able to have these discussions with the patients directly.
Exactly. And I think that's what's so key, because a lot of the people that go into, to come to the events, let's say in Cali, they have that connection and that trust with their own specific neurologist. And so it's that main neurologist that treats them that gives those results back to them, which is different than me coming from the outside and giving
Right.
up to them. And so there is that perfect circle, really, that allows for people to get their information back. So we train them and do the best we can so they can have the best kind of process on what to do during the session and what are the main things that need to be discussed. But then the provider that has that connection and then knows that individual, that participant, can also kind of make it more direct with them.
And they have that relationship, but it also
Yeah.
helps because not every patient, most people can't travel to like larger academic centers. They can't come to the US, to the Cleveland Clinic, right, in person. And so this allows people to have the same level of testing and care that they would get elsewhere, but it can come directly to where they are, and they don't have to travel for it.
Yeah, so the study in itself here, people can get a little kit shipped to their home, or we call it tassel kit, so they can get it shipped, and that way they can collect the sample and then send it back. In Latin America, some people can actually go to these outreach events and, receive or get the test done right then and there, or they can go to their next doctor visit and get it done there. But what's so amazing about the collaboration is that the large PD study actually does a lot of different tests and evaluations as well. So individuals that go will get the chance to get all these kind of testing done, the MOCA and other things, to kind of understand more about themselves. And when I actually went to Cali last year, the relationship that exists with providers in Latin America and their patients is a little different. It's really more like a family, because the doctor would just have like a WhatsApp group, and they would just text in the group and be like, "Hey, we're having an event," and then all of a sudden you would see all these people that would show up, and those doctors are respected and well known in that community, that even people from the outskirts would come. And they themselves have other kind of events where they even go into like remote areas, like really remote areas, and bring all the equipment to be able to do all the testing that they need to do and evaluation to get people to participate. And they do this every so often. So the involvement and dedication that exists from these providers is really encouraging and inspiring. And so it's wonderful to be able to just be a very small part of that.
Is there a website or somewhere people can go to learn more about the study? I don't know if it's still accepting patients for enrollment.
Oh yeah, totally. So the Parkinson's Foundation has the PD generational study on their website.
Okay.
And then for people that want to learn more, there's also the Large PD website that kind of explains more about the consortium, tells you where in which countries in Latin America you can find a Large PD place. And so those are kind of like two different places to find more information.
Okay, and we'll put those in the show notes as well, so people can get them there if they're not able to find them online. One of the things I did want to ask you, or kind of dive a little bit deeper, is I had read the article you'd referenced before about some of the findings from the PD generation study, and it highlighted the diversity in genetic variants or genetic mutations, or finding this variability. Like you mentioned, there are a lot of genetic genes associated with Parkinson's disease, but there's lots of variants or changes within those genes associated with it. Why is it important to make sure that we are looking at diverse populations for research to come up with some of these genetic answers?
Yeah, so I think when we're thinking about diversity in research, at least within Parkinson's disease, a lot of what we know it's really around people that are like, European, white, basically.
Mm-hmm.
And there's less understanding about the genetic differences of people of different racial minorities. And so it is important to be able to have the opportunity to include all these different individuals into research, because there are differences that exist and how it may be some specific variants in genes may be more common in one individual versus another, depending on, for example, where they're coming from. And so it's important to be able to better understand that and eventually be able to get to the goal of personalized medicine. And
Mm-hmm.
in order to be able to get there, you need to be able to include everybody, not just specific group. And so even within kind of what we're learning and what we're doing, there is a recent kind of paper that came out that discussed about the African allele in the gene GBA. And so there are things that we are learning as we are being more inclusive in research. And so I think that the goal will be to be able to include as many people and as many diverse people as we can in order to be able to understand those genetic differences in order to provide eventually better services for people and better opportunities for treatment that are tailored for them.
And when you're talking about whether it's talking about inclusion of different populations or various populations in research, but you're also talking about getting involved with the community and the things that you've been able to do working with the community, or even just seeing how the communities operate and how patients can get care within their own community. I know that you're very passionate about breaking down barriers when it comes to genetic counseling. And I was wondering if you could tell us a little bit more about what drives you in this space and wanting to increase access to genetic counseling and genetic testing, particularly in Parkinson's disease.
I think my desire to do that comes, I guess, from my own personal like experience. Like I am Ecuadorian, and I've seen my parents struggle when they lived here for a little bit in the United States to try to get attention from doctors, because the doctors didn't speak Spanish, and so I was the one that was there, kind of explaining what is going on. And so I think if we have the opportunity to serve individuals in the language that they speak and make those connections, it's the best thing we can do. And it comes from that. I want to be able to have all individuals understand kind of all this information and understand about their own health. And so my desire to try to make things as accessible as possible relates to that. If the fact that the study, actually, the PD generation study, is offered even here in the US in Spanish and English, the platforms where people can go through the studies, it's bilingual. So they actually can experience the whole process of the study in both languages. It's pretty seamless. And that's how I would like for all things to be, because I would love for my parents, for them to be able to go to the doctor if they're here, to understand everything directly and not have things filtered through an interpreter or me, because I'm not always going to be there. And if I'm not there, then things might get lost, and maybe they would not want to ask something because, X, Y reasons. And so that's why I would just, I wanted to be able to use my language, and that passion that I have for, thinking about my family. Like, I would like for my family to be able to understand everything and have the best possible care they can. And so that's how I think about it for other people. At least I can do a little something in Spanish, and so that's where I put all my effort in.
Right. Well, and I think the hope is that other studies, other clinic models can look to what has been working well with PD generation and see, oh, are there parts of this that we can adapt or things that we can utilize and do that would allow us to reach more people?
Yeah. I mean, and what's amazing is that people really want to participate, and sometimes, I know that there are some studies, because in all honesty, translating and doing all these things for the materials, because all of the research materials have to be translated and certified, and it's like an extra process, and so it's a lot. But it is definitely worth it to be able to have people participate, because it really tells that individual from that other that speaks a different language. It really tells them, like, hey, we really care about you, and we really want you to understand what our study is about, and here's the information in your language so you can take it and read it. And so that's why I'm really, like, happy that I get to work with this initiative, because it actually provides all this information in Spanish for participants, and the whole thing it's available in Spanish.
And I was going to ask, what is the most rewarding part about being a research counselor working in this space? And you've mentioned quite a few, but what would you say is the most rewarding part?
Being able to use my language skills is what makes me so happy about it, because it allows me to help people that don't speak the language to be able to understand what's going on. And so I have this possibility to speak Spanish because that's my native language, and being able to use that in what I know about my culture and just being Hispanic, and sharing that with others so I can help them understand what are some of the barriers that people may experience and kind of give them perspective is very rewarding. And aside from having the opportunity to work with wonderful people in the Parkinson's Foundation, like Rebecca de Leon, or maybe Dr. Mata, Cleveland Clinic, and all the providers from America, is amazing to be able to work with all these amazing people, and the people at Indiana. It's there's so many great people that I get to work with that it's very hard to just pick one specific thing.
That's good, though. That's a good problem to have, isn't it?
Yeah, for sure.
We've talked about quite a few things, and I think it's all been great information, but I do know that people walk away and they may not remember the full 30 minutes or however we talked. So to our listeners, what is the main thing that you want them to remember today about the conversation?
I think it's hard to narrow it to just one. So if it's okay, I will just probably say, like, the three take home key points for today.
That's fine.
So I think one would be, if you're an individual that has Parkinson's disease, you want to make sure that you have a great team of providers that are kind of surrounding you in helping you in your care for Parkinson's disease, just to make sure that you can live your best life with Parkinson's. So that would be the first thing. Second, I think it's very important to be able to learn as much as you can about Parkinson's disease. It really is a journey when someone gets that diagnosis, and it can take a long time. And there are a lot of questions that come up. And so there are a lot of organizations that provide very good resources. The Parkinson's Foundation is one of those, and they actually provide information in Spanish and English. There's also the Michael J. Fox Foundation that provides a lot of information. And then the World Parkinson's Coalition also provides a lot of webinars as well. So these organizations provide the information in many different formats. So it can be a webinar, podcast, blog, etc. So those would be great places to find really good vetted information. And then the last one would be, if you are an individual that works with Parkinson's disease or has Parkinson's disease, or you are the caregiver for someone with Parkinson's, then if you haven't had a chance to attend a congress for Parkinson's disease, there's actually one coming up next year in 2026 in Phoenix, Arizona, which is the World Parkinson's Congress. I had the opportunity to attend to the last one. It was a life-changing experience. And so I would very much encourage people to have the plan to go there, just to be able to meet other people that are very passionate about Parkinson's. And the Parkinson's community in itself is fantastic. And so I would definitely encourage that.
Yeah, I was gonna say thank you so much, Priscilla, for being here. Because, like I said, I learned a ton. This is an area I am not familiar with at all. So thank you.
Wonderful to be invited. Thank you so much. I very much appreciate it.
For more information about this episode, visit allaccessdna.podbean.com, where you can also stream all episodes of the show. This link is also in the show notes for easy access. Any inquiries on the podcast can be sent to allaccessdna@gmail.com. Check out our Patreon at patreon.com/allaccessdna and consider donating to get bonus content, submit questions for our guests, and connect with other genetic curious individuals. Note that this podcast is for entertainment and education and is not intended to be a substitute for professional medical advice. Please consult your physician with any questions you may have regarding your health. Please rate and review the podcast on Apple, Spotify, or wherever you listen. This helps other people like you discover the show. All Access DNA is hosted, produced, and edited by Kate Wilson. The logo design is by Designs by NKJ. Thanks for listening, and join us next time.